This is from the Bureau. A dangerous experiment, doctor says ideological Canadian governments ignored evidence as safer supply exasperated fentanyl death surge. A scathing new study by a Canadian addictions physician concludes that ideologically driven social justice governments have worsened the country's fentanyl crisis by aggressively funding and promoting so called safer supply programs, despite a lack of evidence they save lives. Instead, as mounting proof showed that thousands of government distributed opioid tablets, as potent as heroin, were being diverted into the black market by organized crime, Health Canada, public health officials, and sympathetic media outlets continue to defend the controversial programs and attack critics. Even as violent incidents emerged, including a shooting outside a Toronto Safer Supply clinic, the study notes that some advocates called for medical professionals to be removed from program oversight entirely. In a paper published by the MacDonald Laurier Institute, Dr. Laurie Regenstreif, a veteran addictions physician, argues that Canada's Safe Supply program, widely expanded after 2019, have not only failed to reduce overdose deaths, but have coincided with the steep rise in fatalities. The number of opioid related deaths in Canada surged from 3,023 in 2016 to more than 7,300 by 2021, despite increased distribution of government supplied hydromorphone tablets. Reds and Strife warns that the policy, intended as harm reduction, has morphed into a dangerous social justice experiment, sidelining evidence based treatments like methadone and buprenorphine in favor of unproven, unsupervised opioid dispensing. How Canada has to, how Canada has chosen to address opioid overdose is unique, Regenstrife states of her findings released today. No other country in the world would envision a policy in which people with opioid addiction are simply given bottles of opioid pills with the assumption that this will solve their risk of overdose death.
It's
instead,
it's so
it's,
we have to laugh. It's unbelievable.
instead of curbing fatalities, safe supply programs have unleashed a wave of diversion, with powerful 8 milligram hydromorphone tablets known on the street as dillies leaking into illicit markets and being trafficked across the country. She cites a growing body of evidence, also covered in reports from the Bureau, that these pills are not only widely sold and traded by program participants, but also used as currency by organized crime groups. Cited in the study, like minded addiction experts Dr. Sharon Koivu and Dr. Jenny Mullane reported that the street price of
Dilaudid.
Dilaudid 8 milligram tablets collapsed from $15 to $20 in 2020 to as low as 50 cents
Wow.
in late 2021. Things changed within weeks of the hydromorphone hitting the streets, Mullane said. This sudden flood of pharmaceutical grade opioids reshaped local drug economies, allowing criminal networks to exploit the government funded supply chain and expand access to hard opioids far beyond clinical settings. Red and Strife also highlights systematic flaws in the program's implementation. Staff at supervised injection sites often appeared well meaning, but lacked clinical experience and a clear understanding of untreated addiction behavior. They did not grasp the constant pressure felt by users to acquire more drugs, money, or other currency to maintain use. One notable case cited in the report occurred in 2023 when a peer support worker at the Parkdale Community Health Center in Toronto was implicated in a shooting incident. A peer support worker, perhaps with naive but good intentions, ended up on the wrong side of the law in attempting to protect a safe consumption site client involved in a shooting. In her conclusion, Strife warns that comparing opioids to alcohol, as some safe supply advocates do, is a false analogy. Alcohol's harms accumulate gradually. Opioids, by contrast, are acutely toxic and deadly. Canada must chart a better path forward, she urges, one that prioritizes evidence based care, not ideological narratives. That path includes a return to opioids agonist therapy and wraparound services, genuine adherence to medical science, balancing individual and community well being, and reuniting the four pillars of Canada's drug strategy: prevention, treatment, harm reduction, and enforcement.
Yeah, see, they're missing the treatment and the enforcement part of all that, right? I mean, this is the problem. I was meaning on. I was gonna do like one day a analysis between Portugal and what they did right compared to us and what we did wrong. Like I think I'm not necessarily against some sort of decriminalization or legalization, but I think you have to be pretty hard on crime still. You got to have, you got to be like, you can't just roam around in public doing the stuff, and you can't just let criminals out right away like that. So I think we're missing half the picture. But here's a good like follow up story here.